Hi, I'm Abigail Bass, and I'm the Inpatient Discharge Coordinator for Piedmont Transplant Institute. Congratulations on your new kidney. My job is to make you and your support system feel as comfortable as possible going home and taking care of yourself and your new kidney. One of the resources you have in your folder is this booklet titled Caring for a Kidney Transplant. We will be going through this information together, hopefully to help you better understand the load of information we have for you. Before we get started, I like to break down what I think is most essential for you to know going home in the first few days. There's plenty of time to adjust to all this new information, but there are a few things that I think are vital for you to start adjusting to. First is taking your medications, plus drinking plenty of water now. Second is showing up for lab draws and for follow-up appointments. Third is watching out for emergencies. Spanning into all these categories is checking and recording your vital signs. We're going to dive into all of these and more together. For your medications, as you will learn from the transplant pharmacist, your medications are vitally important. You will receive a personalized list of your medications in an easy-to-follow format and will review one-on-one with a member of the transplant team on day of discharge and again at your first follow-up appointment. At time of discharge, you will be assisted in filling out a 7-day pill box with your personalized medication doses. You'll also then need to bring those same pill bottles, your pill box, and your finalized medication list to your follow-up appointments with your transplant for review. Taking these medications exactly as prescribed is essential in keeping your new kidney happy. For water intake, unless instructed by the transplant doctor to restrict your fluid intake, please be sure to drink at least 64 ounces of fluid daily. For example, for water bottles that are 16 ounces each, fluids should be mostly water, non-caloric flavoring is okay, and caffeine-free. Don't start any sports drinks such as Gatorade or Powerade before talking with your team. Now, for showing up for appointments and lab draws. In your book, you will find a chart detailing a general estimate of clinic and lab frequency over the next weeks and months. The first month will require the most frequent visits to Piedmont Atlanta, with 2 visits a week every week for the first month. One of those visits will be a clinic visit, bundled with a lab draw beforehand. That means you will need to show up about 30 to 45 minutes before your appointment to have enough time to get your labs drawn and to factor in any traffic lateness. This visit will be held entirely in the 77 building on the 5th floor. You've already been there for your pre-transplant testing at the Mason Transplant Clinic. Your appointment time, location, and contact number will be written in my chart, which we highly recommend downloading for your convenience. The first visit will be around 2 hours long. Remember to bring all your medications and vital signs log with you and to wait to take your Prograf dose until after your labs are drawn. Please do not skip any doses unless specified to do so. If you can remember, please also adjust your evening Prograf dose the night before your appointment to 12 hours before the appointment for the most accurate lab draw. After your appointment, you should return to your normal medication schedule. Now, the other visit to Piedmont Atlanta will be just for drawing standing labs only. You will be told which day to get these labs drawn, and they must be drawn at this location for same-day results. Eventually, you may get your labs drawn locally, determined by you and your coordinator. Since you do not have an appointment with the doctor on this lab draw day, it will be up to you to arrive by a particular time. I want you to think of your morning medication time as your quote-unquote appointment time. So if you take your medications at 9 a.m. and 9 p.m., 9 a.m. will be your lab time. Now, if you have a time and distance constraint and would like to arrive at a different time, still within the morning hours, you just need to plan ahead the night before. So if you'd like to get your labs drawn as early as possible, the lab opens at 6:30 a.m. and you would need to take your Prograf the night before at 6:30 p.m. Once your labs are drawn, you should take your Prograf and then return to your regular schedule that night. One more appointment to put on your radar is called the stent removal appointment. During surgery, your surgeon put a small plastic tube inside your ureter to keep everything flowing and to avoid leaks or pressure buildup. It is different from your Foley catheter, which drains your urine and is usually removed before you go home. The stent, however, stays in place for about 3 weeks after surgery and then will need to be removed by a urologist. They will insert a thin scope through your ureter to find the stent and take it out. While this is not a surgical procedure, it can be uncomfortable, so it would be wise to bring your pain medications with you that day just in case. We will also schedule this appointment for you and schedule you back-to-back with a transplant appointment beforehand. They're assigned to you by your last name and their contact information will be given to you prior to discharge. They are available to you Monday through Friday, normal business hours, and if you have an emergency outside of these hours, the number listed in your book is your after-hours emergency number. One of our transplant nurse practitioners has this phone 24/7, so you always have someone to call. If you somehow can't get a hold of anyone, you do not need our permission to go to the emergency room. The 2 main categories for transplant emergencies are rejection and infection. In order to prevent rejection, you will be taking your medications exactly as prescribed without missing or skipping any doses. If you run into any barriers to these daily habits, let us know ASAP. If you do not have your medications for whatever reason, insurance, payment, misplaced, etc., let us know immediately. If you have them but are feeling too sick or nauseous to take them for longer than 4 hours, let us know immediately as well. Any nausea, vomiting, diarrhea for longer than 4 hours should be alerted to transplant for evaluation. If you are taking your medications correctly, yet you notice a weight gain of 3 pounds or more and noticeable decrease in urine output, also let us know right away. This is why you should be logging your dry weight first thing every morning. You may notice your weight is elevated since transplant due to the fluids you have received, but your weight should only decrease, plateau, or increase over a long period of time. A 3-pound weight gain or more one morning to the next would indicate holding on to water weight, which we would need to investigate about. Unless your doctor specifically directs you to do so or you go home on dialysis, you don't need to measure your urine. If you are drinking the required 64 ounces of water per day, you should be making plenty of urine. Lots of water plus a working kidney equals lots of urine, as you will soon find out. If you go home on dialysis, please measure your urine daily so that if/when your urine output increases, you have a measurement to tell your transplant doctor. So, to recap, prevent rejection by taking your medications exactly as prescribed and keeping all appointments for lab work and clinic visits. Look out for signs of rejection in your daily weight and urine output. Now for infection. Being a transplant patient puts you in the immunocompromised category, meaning your immune system is forever lower than everyone else's. That means you can get sick more easily, more quickly, and more severely than others, so it is important to let us know ASAP anytime you feel sick. The easiest sign to look out for is a fever over 100 degrees. That is why you will be measuring your temperature first thing in the morning, so you'll have a daily check for any potential developing infection. The rest we will go head to toe for common signs. If you have any respiratory symptoms, coughing, sneezing, runny nose, sore throat, etc., even if it just feels like a cold, I would rather like to know and keep an eye out on you rather than wait till your symptoms are much worse. If you notice any ulcers or white coating in the back of your mouth while brushing your teeth, let us know so we can treat them. This is just a risk from taking oral prednisone. If you have chest pain or difficulty breathing, please call 911. You never need our permission to call 911. To take care of your incision, you will need to take a shower or sponge bath every day, no baths for 2 months, or 8 to 12 weeks, while your incision heals. You may pick whatever soap you like, however, I recommend fragrance-free, and scrub everywhere but your actual incision. Let the soap and water just rinse off of your incision, don't cover it afterwards or beforehand, and then pat nice and dry when you finish. Don't apply any lotions or solutions to your incision, and don't keep a bandage over it either. Trapping any kind of moisture puts it at risk for infection. If you have any pesky drainage that's, getting on your clothes, you may get a gauze or towel to soak it up as long as you remove and change them often and keep it open to air as much as possible. Signs of a surgical infection to look out for would be redness or swelling around your incision, hot or painful to the touch, thick and smelly drainage, or sharp abdominal pain that doesn't go away. Overall belly swelling, bruising, itchiness, and abdominal soreness is to be expected though. Sharp stabbing pain that doesn't decrease with medication, however, should be alerted. Lastly, since you will have a Foley catheter in place since transplant, please look out for signs of UTI, such as burning, painful urination, cloudy, bad-smelling urine, anything that looks like not right. You may notice some odd bladder sensations though, if it's been a while since you made urine prior to transplant. That is also to be expected. You may also notice frequent urination. That is to be expected and encouraged. Please do not try to hold your urine for long and risk building up pressure within. Your bladder will adjust to the new volume in its own time. To avoid nocturnal urination, try and drink half of your water intake before lunch and half before dinner. Now that we've covered the essentials, please turn to the page titled Approved Over-the-Counter Medications. Alexa, our pharmacist, teaches you the pages we are skipping. However, I want to reinforce that your transplant medications take priority and can be affected by other medications. If you would like to take an over-the-counter medication, please refer to this list. If the medication you seek is not on this list, please check with one of our transplant pharmacists prior to purchasing. Similarly, if another doctor would like to prescribe you something not on your finalized list, you will need to check with our pharmacist before that prescription is sent. Continue to avoid NSAIDs like ibuprofen and Aleve. However, you can take Tylenol within the parameters listed on your final medication list. The following page talks about common complications after transplant. I want to draw your attention to the viruses labeled CMV and BK virus. These are common viruses associated with transplant. You will be on a medication to prevent CMV for either 3 or 6 months. BK virus is usually asymptomatic, so we will start checking for it in your lab work starting at 1 month. So if you'd like to check your results on my chart, don't be alarmed when virus pops up. On the following page, we will be talking about infection prevention. I mentioned earlier about it being immunocompromised from here on out. The closer you are to transplant, the more vulnerable your immune system is. I like to say that if you have your natural shields of immunity that you've been protecting yourself with your whole life, we have now shut those shields down with your anti-rejection medications. You still have an immune system, however, your immune system is lower than everyone else's. The closer you are to transplant and the riskier the situation you are in, the more shields I want you to implement. For the first 90 days after transplant, we ask that you wear a mask in public and especially at any healthcare facility. We will give you a supply of masks at discharge, however, we recommend purchasing a supply of N95s as well. Hand sanitizer, hand washing, social distancing from those with active infections, and vaccines are other shields at your disposal. We recommend staying up to date on all your vaccines starting 6 months after transplant. The left-hand column in your book, in the chart in your book, details vaccines are safe to take in 6 months. The right-hand column, on the other hand, are not safe to take after transplant ever. These vaccines are either the live versions of vaccines that put you at risk for contracting the illness itself, or there's just not enough evidence to show that they are safe enough for transplant patients. As for your loved ones, they can take the safe vaccines at any point and be around you. However, if they need to take the not safe vaccine, they will just need to protect themselves away from you for a few days while their body turns the vaccine into immunity. Your body, being immunocompromised, would not do this. Lastly, our advice for precautions around young children is not an exact science. If a child, or any adult for that matter, has symptoms of an active infection, especially accompanied with a fever, that is your sign to stay away and protect yourself for as best you can. Your body can go from 0 to 60 a whole lot faster now, so you will know if you get sick. I would recommend wearing a mask around small children right now and incorporating more hand washing in your interactions with them. The younger they are, the more they have to get sick to build their immune systems, the more likely they will get sick at daycare and school, and the more they are still learning to cover their coughs and sneezes. We also recommend you stay away from large crowds and limit your visitors at the beginning. Focus on adjusting to your transplant for now. We ask that you take all these risks into consideration as to avoid infection as best you can. My last point, though, I will reinforce is that you have a new kidney to live a life. I talk about shields so that the more you use, the more freely you can live your life. Next, we will review diet considerations. There are a few foods that interact with your transplant medications, so you will have to avoid them lifelong. They are grapefruit, pomegranate, jackfruit, dragon fruit, green tea, herbal teas, and any herbal supplements. Even if these are not a part of your regular diet, please pay attention to food and drink labels and check for these ingredients on the ingredient lists on the packaging. We also recommend you temporarily hold off on drinks with added electrolytes like Powerade or Gatorade, since we will be adjusting your electrolytes a lot in the coming months. For food safety, we recommend no sushi, like no raw foods, no oysters, no undercooked or raw meats. We also recommend refraining from buffets. However, if you are at a buffet or a group meal like a cookout, barbecue, potluck, or holiday dinner, we have some tips for you. You can either ask the kitchen for a separate plate to be made just for you, ask the host to make a separate plate ahead of time for you to eat whenever you're ready. You could eat ahead of time with your own meal at home, or you could just go first through the line and basically everybody is eating your leftovers. I like to say you're a VIP when it comes to food, because the last thing anyone wants is food poisoning, let alone you with a compromised immune system. Lastly, your electrolytes. You will need to restrict your potassium for at least 6 months after transplant. This means avoiding things like potatoes, bananas, avocados, oranges, and tomatoes. On the other hand, though, if you have a working kidney, your brain does not realize it has a working kidney for about 4 to 5 months. So it's not used to holding on to phosphorus and magnesium. This means not only do you get to incorporate those electrolytes back into your diet, but you will likely be deficient in those electrolytes, so you may even need to be on a replacement medication. So if you have missed dairy products like milk, cheese, and yogurt, whole grains, beans, nuts, and even dark sodas, you're in luck. We do still recommend your diet be lower in sugar and sodium, so I would opt for the Diet Coke over the regular Coke. Overall, prioritize protein in all your meals, since protein is the building blocks of our bodies, which will help with healing. Regarding exercise, we recommend walking a minimum of 3 times per day. The hardest part is getting out of bed, out of your chair, but ultimately it will be what heals you and helps with your pain the most. Conversely, the longer you sit in one place, the stiffer your muscles will get and the more pain you will have and the longer it will take to heal. I care more about frequency than distance, so even if you just make a lap around the house or to the mailbox and back, setting yourself goals every day will be helpful and motivating to keep moving. You will be on abdominal precautions for 8 to 12 weeks. This means no bending, lifting, or twisting, or BLTs for short. Bending means bending down as well as sitting up. To To put your shoes and socks and pants on, simply sit on the side of your bed or in a chair and bring your legs up to you. Otherwise, ask a support person to pick an item up for you. To get out of bed, you will need to use the log roll technique. In your folders is an information sheet developed by the physical therapists demonstrating how to do this. The precautions also include not lifting more than 5 to 10 pounds and not twisting. Bending, lifting, and twisting before your incision is healed can not only be painful, but can put you at risk for developing a hernia. You may drive once your staples are removed and you are no longer taking narcotics. Your staples will be removed in about 3 to 4 weeks after surgery in clinic. That also means you will need to find someone to drive you to your frequent visits the first month. You can return to work as well as sexual activity whenever you feel up for it. Just be mindful of your abdominal precautions, your limitations, and your energy as you recover from this major surgery. You do not need our clearance to return to either. If you are a woman under the age of 50, regardless of menopause status, we ask that you implement at least 2 forms of birth control to avoid birth defects while on the medication CellCept. If you would like to become pregnant, discuss with your provider and they can switch you to a different medication. Regarding substances, smoking is discouraged because your lungs cannot handle anything other than oxygen. Smoking, even secondhand smoke, puts you at risk for pneumonia. Alcohol, 1 to 2 servings though, within a single day, is safe once you are off narcotics. Pets are safe to have in the household as well, as long as they are kept well groomed and you wash your hands after handling them, especially before you eat. When picking up after an animal, after your abdominal precautions have ended, please use gloves as well as a plastic bag and wash your hands afterwards. Litter boxes, tanks, and cages all pose a higher risk of infection since the animals interact with your feces more. This does not mean they are prohibited, but you will just need to be more diligent about infection prevention around these animals. If you have a large dog that likes to jump at your arrival, I'd make sure to have a bodyguard to protect you from being knocked over since you do not have the same abdominal strength right now. Regarding traveling, we recommend waiting 3 months to travel domestically and 1 year to travel internationally. This makes the process a whole lot smoother for everyone involved and you can enjoy your stay with peace of mind. Anytime you do travel, please let your coordinator know so we can get your medications and your appointments arranged. Never check a bag with your pills in it. Always keep them in a carry-on with you. Otherwise, you may lose them. Lastly, anytime you are driving or flying for longer than about 90 minutes, please get up and stretch your legs since you are more at risk for blood clots. Don't want those. Regarding outdoor activities, you are now at a higher risk of developing skin cancer, both as a transplant patient and while taking the medication Bactrim. This means wearing sunscreen every day, no matter what. No matter your melanin protection, no matter how hot or cold the weather is, how cloudy or sunny the skies are, no matter if you stay inside, just make it a part of your everyday routine. We will give you SPF 30 to go home with. Make sure you apply at least to your face, neck, hands, and back of your ears. If you would like to go swim, you can swim once your incision is completely healed in about 8 weeks. However, only certain bodies of water are considered safe to swim in: oceans, pools, and bathtubs. Lakes, rivers, and hot tubs, however, are all high infection risks, so we strongly encourage you to stay out of these bodies of water. If you like to mow the lawn, remember to wear your sunscreen as well as a good mask to protect you from the dust and dirt that you can inhale. Same goes for construction sites. If you like to garden, also wear your sunscreen as well as good gardening gloves. In all outdoor activities, wash your hands as much as possible. Regarding other appointments and providers you may need to see, we recommend you postpone most appointments 6 months from now. This includes your dentist, eye doctor, nephrologist, and primary care physicians. This is because we want you to focus on transplant. We plan to transition you back to your nephrologist starting at about 6 months anyways. We also don't want you to be at risk for anything invasive like a tooth filling, so those can all wait 6 months. If you need to see a specialist sooner, just talk with your transplant team at your follow-ups. We do recommend you see a dermatologist yearly, so someone is checking out your skin, and speaking of skin, prednisone can affect your skin and hair. Your skin can be drier, so make sure you get a good lotion and apply right after getting out of the shower when there's still some water droplets on your skin to lock in some moisture. It can also thin your hair starting about 6 months after transplant, so if you would like to get ahead of that, start incorporating something now, like a biotin supplement or a biotin shampoo or Rogaine or Nioxin or even rosemary oil massage into your scalp. Lastly, if you would like to write to your donor's family, you are welcome to do so. There's no time limit or requirement to do so. However, if you would like to, just bring in whatever you write to the clinic and we will pass it on to the family for you. Just leave your last name, phone number, and any identifying information unless you hear back and they would like to connect with you. The clinic has plenty of resources to help you write your letter if you'd like. This completes our review of discharge education. I know it is a lot of information, but I hope this video answers some of your questions and maybe even stirs up new ones. I recommend writing any questions you don't want to forget to ask in the back of this book. Take your time to absorb this information, read through your folder again in entirety before your next appointment, and don't hesitate to call if you have any questions. Congratulations on your new kidney and welcome to transplant.